Hi, I'm Dr. Max Lingenfelter. Welcome to our video on the treatment of arthritis of the hip. This x-ray shows an example of mild hip arthritis, demonstrating minimal narrowing of the joint, very subtle bone spur formation, and normal alignment. A patient with a hip x-ray like this would likely walk with an unaffected gait. They may still be quite active, but experience sporadic groin pain with certain movements or range of motion. But they most likely would be performing activities they enjoy with minimal disruption of pain and therefore experience minimal quality of life disruption. Treatment options would include avoiding the activities which hurt, using Tylenol or anti-inflammatory medication known as NSAID, like ibuprofen, which must be discussed with your doctor. Physical therapy can also be used to help strengthen the muscles around the hip. And lastly, weight optimization will also help reduce the stress and alleviate the pain. This is what moderate arthritis looks like on x-ray. There is progressive narrowing of the joint as the cartilage becomes thinner. There are larger bone spurs and there is nearly bone-on-bone contact, but not quite. A patient with an x-ray like this would experience mild changes in their gait due to pain. They would most likely have to significantly change or eliminate activities which result in pain, and therefore would experience a moderate reduction in their quality of life. Treatment options would include physical therapy to further strengthen and support their muscles, continue NSAID or anti-inflammatory use, and you may want to consider a higher dose or stronger formulation such as meloxicam or Celebrex, which you must be discussing with your physician. Tylenol can also be used as an adjunct. They should consider using an injection such as cortisone or steroid to help improve their quality of life, which could also reduce the amount of oral medication that is required. This injection typically needs to be scheduled with an ultrasound specialist, and a cane may become part of the picture. Lastly, weight optimization efforts should be continued. And this is what severe hip arthritis looks like. Distinctly, the bones are touching at this point, and this is what we refer to as bone-on-bone arthritis. And this is a hallmark that indicates this patient really should start thinking about surgical treatment, such as a hip replacement. A patient with an x-ray like this likely is experiencing a significantly affected gait while walking. They may experience symptoms of catching or giving out. Typically, putting on shoes and socks becomes very difficult, and patients may have to switch to shoes with no shoelaces. Putting this all together, they experience severe quality of life reduction, and for this reason, the mainstay of treatment is replacement to fix the underlying structure of the hip. They may consider a repeat injection if the timing is not right for recovery from a hip replacement. And certainly a cane or a walker may be needed at this point to help support the structure of the hip joint. And they can also continue NSAIDs. Thank you for watching our video on arthritis treatment of the hip. And please join us for our next video on what exactly is a hip replacement. If you found this video helpful, please like and share with your friends and family who could benefit as well. Thank you and have a nice day.